Hello everyone, welcome back to my YouTube channel. Today I'm going to discuss about the anatomy of maxillary artery. Here you will learn about the cause of the maxillary artery, the three parts of the maxillary artery, as well as the branches of the maxillary artery and what are the areas that is supplied by the maxillary artery. So here you can see the common carotid artery and the external carotid artery and internal carotid artery. From my previous video, I discussed about the external carotid artery. So I'll put the link in the description box as well. Then you can watch the video and learn about the cause, the branches and the relations of the external carotid artery. So here you can see the common carotid artery. It divides into two as external carotid artery and internal carotid artery at the level of upper border of the thyroid cartilage, and it ends up at the substance of parotid gland behind the neck of the mandible by dividing into two divisions as maxillary artery and superficial temporal artery. Here you can see the two terminal branches, maxillary artery and superficial temporal artery. Out of the two terminal branches, maxillary artery is the largest terminal branch. You can see this is the maxillary artery. So the maxillary artery begins behind the neck of the mandible in the substance of parotid gland, as I told you previously. It divides into three parts. First part and the second part are located in the infratemporal fossa, while the third part located in the pterygopalatine fossa. So, where maxillary artery begins? It begins behind the neck of the mandible in the substance of parotid gland. How many parts are there in maxillary artery? There are three parts as first part, second part and third part. So the first part and second part in the infratemporal fossa, while the third part in the pterygopalatine fossa. So from this picture you can see clearly the three parts of the maxillary artery. This part is the first part, then the second part, then the third part of the maxillary artery. So the first part of the maxillary artery we call it as mandibular part as well. It extends from the mandibular neck up to the spinomandibular ligament. There is a ligament called spinomandibular ligament. Spinomandibular ligament attached from the sphenoid bone, and then the other attachment is to the mandible. Spinomandibular, the name as the name implies, it attached to the one end attached to the sphenoid bone and the other end attached to the mandible. So the first part runs along the lower margin of the lateral pterygoid muscle. It also accompanied by the maxillary vein. First part is also called as the mandibular part. It extends from the mandibular neck up to the spinomandibular ligament. There are 5 branches in the first part of the maxillary artery. They are, you can see the deep auricular artery, then you can see the anterior tympanic artery, then you can see middle meningeal artery, accessory meningeal artery and inferior alveolar artery. Those are the 5 branches of the first part of the maxillary artery. Then the second part of the maxillary artery. Second part of the maxillary artery also called as the pterygoid part. It ascends obliquely forwards and upward between the lower head of the lateral pterygoid and the temporalis muscles. Then that part passes superficial or deep to the lower head of the lateral pterygoid muscle. The pterygoid venous plexus surrounds this part. This part also gives branches, and they are, you can see the mesenteric branch, then the pterygoid branch, deep temporal arteries, and the buccal artery. First part gives 5 branches as deep auricular, anterior tympanic, middle meningeal, accessory meningeal, and inferior alveolar artery. Second part gives 4 branches as mesenteric branch, deep temporal branches, then pterygoid branch and buccal artery. When we talk about the third part of the maxillary artery, we call it as pterygopalatine part as well. It passes between two heads of the lateral pterygoid muscle and it enters the pterygomaxillary fissure to reach the pterygopalatine fossa. There are 6 branches which arise from the third part of the maxillary artery. You can see only few branches in the third part. Here one is spinopalatine artery, then posterior superior alveolar artery, then infraorbital artery here, then the descending palatine artery. Only these branches you can see. Look at this picture here. You cannot see the second part of the maxillary artery. Here you can see the first part. Here the origin of the maxillary artery and the first part behind the neck of the mandible. You cannot see the second part because it is behind the inferior head or lower head of the lateral pterygoid muscle. Again, you can see only the third part of the maxillary artery. Let's have a look on the cause of the each branches separately. When we talk about the deep auricular artery, it ascends in the substance of parotid gland and pierces the bony or cartilaginous part of the external acoustic meatus and supplies to the temporomandibular joint and external auditory meatus. This deep auricular artery supplies temporomandibular joint and external auditory meatus. Then the anterior tympanic artery enters into the tympanic cavity here. It enters into the tympanic cavity or middle ear through the pterygotympanic fissure. In this area, there is a fissure called pterygotympanic fissure. So, the anterior tympanic artery enters into the pterygotympanic fissure and goes towards the tympanic cavity. Then the accessory meningeal artery enters into the accessory meningeal artery enters into the cranium through foramen ovale and supplies the dura mater. Accessory meningeal artery enters into the cranium through foramen ovale and it supplies to the dura mater. Then here the inferior alveolar artery. You can see the inferior alveolar artery here clearly. Inferior alveolar artery enters into the mandibular foramen here and to travel in the mandibular canal. It travels in the mandibular canal located inside the body of the mandible as you can see here. Then it gives lingual and mylohyoid arteries. Lingual and mylohyoid arteries before entry into the mandibular foramen. Lingual artery supplies the tongue and the mylohyoid artery accompanies the mylohyoid nerve in the mylohyoid groove. In the mandibular canal, inferior alveolar artery gives branches to the lower teeth as you can see in this picture. Here is the mental foramen and here is the mental artery. So, the mental artery is a branch of inferior alveolar artery which comes out from the mental foramen. Here, the other branch, you can see the middle meningeal artery. You can see it supplies the temporal region of the skull as well as the meninges. You can see its course clearly here. The middle meningeal artery ascends upward in between the nerve branches of the auriculotemporal nerve. You have to remember that in between auriculotemporal nerve. After it ascends further upward, as you can see here, it divides into anterior branch and posterior branch. Then the branches of the second part of the maxillary artery are first, the deep temporal branches. There are anterior and posterior deep temporal branches, as you can see in this picture. They enter into the temporal fossa. This region is the temporal region, temporal fossa, to supply temporalis muscle. There is a separate pterygoid branch here, and the pterygoid branch supplies lateral and medial pterygoid muscles. This supplies to the lateral and medial pterygoid muscles. Then the masseteric artery here, it passes through the mandibular notch along the masseteric nerve to reach the deep surface of the masseteric muscle here. Masseteric branch supplies masseteric muscle. Then the buccal branch, it runs forward along the buccal branch of the mandibular nerve and it supplies external surface of the buccinator muscle. It also provides blood to the buccal mucosa. So, the muscles of mastication. Those are the masseteric muscle, then masseter muscle, then the temporalis muscle, buccinator muscle, lateral pterygoid and medial pterygoid. Those are the muscles of mastication. So, you can easily remember the second part of the maxillary artery gives blood supply to the muscles of mastication. Deep temporal arteries gives blood supply to the temporalis muscle. Masseteric branch gives it supplies to the masseter muscle. Buccal artery supplies to the buccinator muscle. Pterygoid branch supplies to the medial and lateral pterygoid muscles. So you can easily remember that the branches of that part as those. Then the branches of the third part of the maxillary artery, or the branches in the pterygopalatine fossa. I told you earlier as well, the third part you can see in the pterygopalatine fossa. So, there is a branch called posterior superior alveolar artery. Posterior superior alveolar artery arises just as the maxillary artery enters into the pterygomaxillary fissure, and it sends branches to the upper molar teeth. As the name implies, alveolar, posterior superior alveolar artery, it gives blood supply to the posterior and superior part of the alveolar process. That means to the upper molar teeth. Then the infraorbital artery. Here you have the infraorbital artery. It may arise in common with this posterior superior alveolar artery. You can see, and it enters into the orbit through the inferior orbital fissure. You can see it entering. It is entering into the inferior orbital fissure and courses forward in the infraorbital groove and canal in the floor of the orbit. Here you have the orbit and it goes to the floor of the orbit along with the infraorbital nerves. Then the artery appears on the face through the infraorbital foramen here. Imagine below the orbital cavity there is infraorbital foramen and the artery appears in the infraorbital foramen. In the infraorbital canal, it gives rise to orbital branches for orbital contents and anterior superior and middle superior alveolar branches for the upper teeth. Then, greater palatine or descending palatine artery. This is it has named as descending palatine artery, but we call it the greater palatine artery as well. So the artery descends in the greater palatine canal. It descends in the greater palatine canal and enters the oral cavity through the greater palatine foramen. Then it travels anteriorly on the surface of the hard palate to reach the incisive foramen, through which some terminal branches enter into the nasal cavity. Lesser palatine artery is a branch of the greater palatine artery. Remember that. Lesser palatine artery is a branch of the greater palatine artery as it lies in the palatine canal. So these small arteries emerge through the lesser palatine foramen into the oral cavity. Here from this picture you can see the course of the infraorbital artery. Here after it enters into the infraorbital fissure, you can see it is coming through the infraorbital groove and the canal in the flow of the orbit. You can see this is the orbit and this is the flow of the orbit. It comes through the infraorbital groove and the canal, and it appears in the face or comes out in the face via this infraorbital foramen. You can see clearly. Here is a picture of a hard palate. You can see this is the greater palatine foramen here. These are the greater palatine foramen in the hard palate. These are the lesser palatine foramen. This one and this one. They are lesser palatine foramen. Greater palatine artery descends in the greater palatine canal and it enters in the oral cavity through the greater palatine foramen. You can see it, and it is entering through to the oral cavity through greater palatine foramen. It travels anteriorly. You can see then it travels anteriorly on the surface of the hard palate to reach the incisive foramen. You can see this is the incisive foramen. So this greater palatine artery travels anteriorly to reach the incisive foramen, and from the incisive foramen there are some terminal branches which enters into the nasal cavity. You have to remember the course of the greater palatine artery clearly. It is not coming from the incisive foramen towards the posterior aspect. It goes from the posterior aspect towards anteriorly to the incisive foramen and gives some terminal branches to the nasal cavity via this incisive foramen. You have to remember that clearly. So these lesser palatine arteries are some branches of the greater palatine artery. You can see they have emerged from the lesser palatine foramen into the oral cavity. So I think it is the course of the greater palatine artery is clear now. When we talk about the sphenopalatine artery, it is the continuation of the maxillary artery. Sphenopalatine artery, we call this as the continuation of the maxillary artery. It leaves through the sphenopalatine foramen to enter into the nasal cavity. This sphenopalatine artery enters into the nasal cavity and it involves the anastomosis of the little area as well. You cannot see the pharyngeal artery here. So remember the course. The pharyngeal artery leaves through the palatino-vaginal canal and supplies nasopharynx, auditory tube and sphenoidal sinus. You cannot see the artery of pterygoid canal also in this picture. So remember that it leaves through the pterygoid canal and supplies nasopharynx, auditory tube and the tympanic cavity. Rest of the branches I discussed earlier. Again, as a summary, in the first part of the maxillary artery, there are 5 branches: deep auricular artery, anterior tympanic artery, middle meningeal artery, accessory meningeal artery, and inferior alveolar artery. In the second part, there are 4 branches which gives blood supply to the muscles of mastication. Those are masseteric branch to the masseter muscle, buccal branch to the buccinator muscle, pterygoid branches to the lateral pterygoid and medial pterygoid, deep temporal arteries to the temporalis muscle. Then in the third part of the maxillary artery, there are 6 branches. Here you can see only 4 branches as infraorbital arteries, sphenopalatine artery, posterior superior alveolar artery and descending palatine artery. There are other 2 branches as artery of the pterygoid canal and pharyngeal artery. So those all together there are 15 branches in the maxillary artery. Hope you can understand the cause and the branches and their distributions of the maxillary artery. So if you could gain some knowledge regarding maxillary artery, Please subscribe into my channel for more videos, and if you like this video, put a comment in the comment section and put a like. So thank you for watching.